Hi, my name's Dr. Benjamin Dorfman, and I'm a movement disorders neurologist at Hartford Healthcare's David and Rhoda Chase Family Movement Disorder Center, part of the Ayer Neuroscience Institute. Movement disorders neurology is a subspecialty within neurology that focuses on conditions that involve excessive or reduced motion in patients. Parkinson's disease, essential tremor, restless leg syndrome, tardive dyskinesia, dystonia are some of the more common conditions we see. The most common disease that we see is Parkinson's disease, both because it's a common condition and it's becoming more common, but also because it's a condition that requires a lot more long-term care compared to some other more common neurologic conditions. Treatments of these conditions typically involve various medications, rehab therapies, sometimes involving other specialists outside of neurology to help treat the whole person. I knew that I was interested in the neurosciences even before I knew whether I wanted to treat patients or not, because I studied it when I was in high school and college, and as it turned out, my first job after college was working in a movement disorders clinic. And that was what cemented for me both that I was interested in the neurosciences and movement disorders, but even medicine in general. It can be very satisfying to provide somebody an answer to a question they've had for a long time that maybe they haven't been able to get a satisfactory answer to. And in a lot of cases, we're also able to provide them with a treatment that's able to relieve a symptom that's been very bothersome and disabling. I would encourage referring providers to send patients to us who are suspected to have a condition that's affecting their movements and sometimes other aspects of their thinking as well, be it cognition or autonomic function. But if it's a patient with problems with moving too much or too little, those would be the patients we see in movement disorders. I would let patients know that the visit will involve a lot of questions and physical examination to try to get a better sense of what might be causing their symptoms, and then follow-up testing, including blood work and MRIs, are commonly sent as well. Outside of medicine, my primary focus is my family and 3 young children, and going on adventures throughout the state of Connecticut with them. I think it gives me a better perspective on what the lives of patients who live around us are, and what kind of challenges they may come up with, and sort of who they are and what makes them tick as well.